So I think there are a few significant developments happening in hematology right now. If we look at malignant hematology, there are various trials. For example, AML, acute myeloid leukemia, is quite a fatal disease, and we've only had a few options for managing this in the decades ago. But now there are a lot more treatments, including a lot more targeted therapies, and we have several trials to assess either these therapies or existing therapies in different combinations, such as the EML-18 trial and the EML-19 trial. If we look at other things such as morphology, morphology is a part of diagnostics which is imperative in hematology. It allows us to diagnose the simplest conditions such as iron deficiency anemia to more complex conditions such as lymphomas and leukemias. Nowadays we use morphology by taking a blood sample, looking at it under the microscope. But now some trusts use digital morphology, so they can actually get a machine to analyze blood samples and hopefully in the future bone marrow aspirates, and these things can then be transmitted across the country digitally so that we can diagnose patients a bit more easier and a bit more conveniently, like how radiologists would look at an x-ray. And I think that's something that we're working towards, I know, in the West Midlands, digital morphology. And I think lastly, just to touch on targeted therapies, and this is something that I think most hematologists would be aware of and that they would talk about. We have immunotherapies which actually modify the way in which somebody's own immune system tries to kill or target a cancer. And we have a lot of research into immunotherapies right now, and we have existing sort of targeted therapies such as rituximab and imatinib and ruxolitinib. So I think these are all the exciting developments that are occurring in hematology from both a malignant point of view and a non-malignant point of view.